Can I just welcome everyone to another webinar about medical research, COVID-19 and the vaccinations. My name is David Boudreau. I'm the Executive Director of Business Western Sydney. We are huge supporters of what is happening, the work that's been undertaken over at the Westmead Institute for Medical Research. They are at the heart of that huge Westmead precinct, and we've been quite involved working with Professor Tony Cunningham and others for a number of years now, trying to support the good work they do. And I guess initially that was because Western Sydney has a jobs deficit and a deficit in knowledge jobs and higher order jobs. And so some of the smartest jobs in our whole region are actually at Westmead, and we see that as very much part of our future. And today, we're doing this on a very interesting day because the Premier has just announced that there's a new health order. We're going in now to our third week of a lockdown, and the restrictions are increasing. And this has got a huge impact on our community, and everyone's interested in this. So we've got, I think, a few hundred people who've joined in today to be part of this. So I'm going to say very little other than thank you, Tony, and the team over at Westmead for the great job you do. We know that of your 5 big research areas, 2 of them are actually right in this area, virus research and immunology. So you are seen as the experts in our region on this, and I know you're working on this every day, and so we're really keen to hear from Tony and Sarah. And to introduce you and to do our welcome and everything is Ivan Power, who is a proud product of Western Sydney, having grown up just down the road in Northmead, and he's had a career working around the world, and he's bringing some of that expertise and passion and energy to support and drive the foundation that's been established to help Westmead Medical Research Institute. So Ivan, I'm going to hand over to you to conduct this webinar.
Thank you, David, and thank you to Business Western Sydney for hosting us for yet another session. As David said, my name is Ivan Power. I'm a director of the Westmead Institute for Medical Research, or WIMR, as we call ourselves, and I'm the chair of the foundation out there. I'd like to begin just by acknowledging the traditional custodians of country and their connections to the land on which we gather remotely, and we pay our respect to their elders past and present. No doubt, as David said, you've heard the news this morning. We're at a really key moment in Australia, and particularly in Western Sydney. Our objective today is to help you sift through the huge volume of COVID-19 information that's coming your way and that has come your way, especially as it relates to vaccination. These are issues that are fundamental to your health, welfare and prosperity, but also to that of your families and your communities and the businesses that you might run, own or work in. We'll be going through a range of issues, looking at data from other countries who've had a different COVID experience from Australia, how the virus is actually changing as it moves around the world and talking about these variants, how vaccination actually works and protects you and those around you, and also the risks associated with vaccination. We're not aiming to give you specific medical advice. We're not aiming to predict the future. We're certainly not going to comment on policing or political matters. We just want to ensure that you as leaders have a very solid base of information, the opportunity to ask some specific questions from global experts in infectious diseases and COVID, and really importantly, some clear ways of being able to communicate this to other people. We've been doing this in some specific sessions for some quite large employers who found it pretty useful. So those of you who enjoy what we see today and want to find a way to get it into your own workplace, please get in touch. No doubt there's plenty of people on this call who may have already been vaccinated or have got one shot. You might think that because of that, you're safe and your job is done. Well, it may be that you are safe, but we do hope to convince you by the end of this that your job's not quite done. There's actually more that you can do for the battle against COVID. The people in our workplaces and our communities often look to us as business leaders for reliable advice and information at really key moments in their lives. Helping them find ways of reliably filling the information vacuum that relates to COVID and especially to vaccination is really one of those moments, and it has implications for them as well as for all Australians. We're really fortunate this afternoon to be joined by 2 of Australia's most experienced and preeminent medical scientists in this field, as David said, namely Professors Tony Cunningham and Sarah Palmer. Tony and Sarah have had distinguished global careers at various times fighting on the front line against the AIDS epidemic in the United States, And Australia, and particularly Western Sydney, is now so fortunate to have them back as co-directors of the Centre for Virus Research at WIMR. They're also part of the Faculty of Medicine and Health at the University of Sydney. For those who don't know, WIMR and Westmead more broadly has been a really key component in Australia's battle against COVID. We've been involved in almost all aspects of the public health response, from testing through to tracing to treating sick patients and in the development of vaccines. In fact, Tony and Sarah are working on the development of a second generation vaccine for COVID that's focused on elderly and immune suppressed patients for whom standard vaccines might not be sufficient right as we speak. Just a reminder to everyone that we're going to leave plenty of time for questions at the end of this session, which you can log using the chat function, which you'll find on Zoom. Sarah, starting with you, at home today, we often start these sessions noting by how fortunate that Australia has been with COVID relative to the rest of the world. And whilst that's still true with relative levels of illness and death, it appears that the dynamic has changed somewhat in terms of how the disease is actually spreading. Maybe give us a bit of an insight as to what's happening overseas these days, starting with developing countries and also what's going on in developed countries.
Sure. Thank you, Ivan. Yeah, so in many developing countries, such as the UK and the US, are starting to open up and remove restrictions. And this is really due to the fact that they have advanced vaccination programs in which 50% of their population is fully vaccinated, and then up to 70% of their population has received at least one vaccination. But as people start to move about in these countries, we are also seeing a spread of the virus happening as well. And the virus that is spreading in both of these countries is the Delta variant. This variant is highly contagious. It's also 60% more infectious than the other variants. And we are seeing an uptick in the Delta variant infections in both of these countries. But there's a difference in severity of disease, hospitalization, and death in between people who are unvaccinated compared to people who are vaccinated. So there's a difference in how this variant affects those who are unvaccinated. And a recent report by the infectious disease specialist in the United States, Dr. Tony Fauci, he just reported that of the over 99% of deaths that are related to recent COVID infections, all of these deaths have been found in unvaccinated persons. So really, in developing countries who have reasonable amounts of vaccines available, there is a choice, and there's a twofold choice. The first choice is, how do we develop immunity towards COVID? And the first choice to develop this immunity could be through vaccination. The second choice could be through natural infection. But with natural infection of the Delta variant, this could lead to severe disease and hospitalization, and in some cases, death. So we do have a choice how we choose to develop immunity towards this virus. In developing countries such as Indonesia and India, these countries are severely suffering and acutely suffering from this COVID pandemic. And this is due in large part to the low vaccination rates in these countries, and also to the less advanced healthcare systems that they have. So these countries are facing an increase in infections, and they're facing an increase in infections of the Delta variant as well. And in fact, the catastrophic surge in cases and deaths that we're seeing both in Indonesia and India are a result of Delta variant infections. So these developing countries who don't have large amounts of people vaccinated are really experiencing a very severe pandemic at this point. But this also has implications for the world, because as the virus replicates in unvaccinated and partially vaccinated people, it provides the opportunity for the virus to mutate and to develop more infectious and more pathogenic variants. So overall, Ivan, what we are seeing is a global race between vaccination and variants.
Sarah, thank you. Tony, I'd be really keen, listening to what Sarah's just had to say, could you maybe unpack for us a little bit about, firstly, how viruses actually mutate and vary, but secondly, maybe tell us a little bit about the Delta variant itself, relative to the COVID that we saw emerging here in Australia when it was last actually, spreading at any rate in the Sydney community, more than 12 months ago. Could you maybe just unpack those two things for us?
Yeah, as Sarah has indicated, when we first looked at this virus, we thought that it wasn't going to mutate very much, unlike flu. That's proven to be incorrect. And we know that what was called the UK variant, or the Alpha variant, was 50 to 100% more spreadable than the original one out of Wuhan that spread around the world and originally affected us. And then Delta is 60% more spreadable than this. And as Sarah said, we're seeing more cases in young people, and we're also seeing cases of increased cases of serious illness and death, to such an extent that some of the ICUs of major hospitals in Sydney are starting to fill up. And that's the fear. People who think it's just the same as last year are wrong. There is a risk that if this gets away from us, that we might actually have that particular problem. Now, why do you get variants like this? Well, the virus, if you think about it teleologically, wants to, in essence, spread. It wants to infect more people. And it does this by altering the structure of that spike you've seen on the virus. Looks like a little spike thing floating across your screen on the ABC. The tip of that spike binds to the cells that it infects. And this virus has managed to change its spike so that it grabs cells more tightly. And that's what these variants do. The other concern we have is that vaccines protect against infection and disease, and they do protect against infection, not completely, but certainly they protect against disease by producing antibodies which interpose between that spike and the cell itself. And the worry we have is whether there are sufficient changes in that spike that might actually reduce the effectiveness of our vaccines. Fortunately, that's not true with people who are fully immunized, and that's why you need 2 doses, because 1 dose of the vaccines is only 33% effective, whereas it was well above 50% effective against the original strain. So the Prime Minister today was pushing people to have their second vaccine as quickly as possible. You'll get some protection against disease. You'll get some good protection against serious illness with 1 immunization. But when it comes up, you need to have your second injection as soon as you possibly can. Fortunately, this Delta strain doesn't seem to be as evasive of vaccines as the Beta strain in South Africa, which hasn't penetrated here. So the vaccines are going to work. We might need boosters for variants next year. We might need boosters because the vaccines tend to wear off over time. But for the moment, the best thing anybody can do is get immunized and fully immunized as quickly as possible.
Thanks, Tony. And so, Sarah, coming back to your earlier comment about the race, which between vaccines and Delta, really what it sounds like then is that the race is actually vaccinating as much of, firstly, Australia as we can, but secondly, actually the world, in terms of actually vaccinating people as best we can to suppress the virus from being able to circulate and therefore come up with more mutations that become, as Tony's described, more infectious or more deadly, or worse still, both. Is that fair?
That is very fair. So what we really need to see is global vaccination rates increase. Currently, we're at 11% of the population across the globe is fully vaccinated. And until we see this to close to more 70% or 80%, this virus is going to take advantage of those who are unvaccinated or even those who are partially vaccinated. And this is a big worry because we're concerned that, yes, we have the Delta variant, but there could be other variants that would arise due to the virus replicating throughout lots of different immune systems and billions of people worldwide.
So if we move along to vaccines, and Sarah, if I could maybe start with you. Let's pretend you're speaking to my 10-year-old and you've got his attention for a couple of minutes about the COVID vaccine, and you want to describe how the vaccine works and what it does and how it prevents against both infection, about infectiousness, about how it prevents against hospitalization and death. Where would you start?
Well, first I would say to your son, you are the host for this virus. And the one way that we can prevent the virus from infecting you is to have you vaccinated and have your immune system respond so it can protect you from this virus infecting you. And furthermore, this vaccine could possibly reduce the amount of infection that your body experiences. So it prevents you from spreading the virus to your father, who's sitting right here, or your mother. So not only is it protecting you, but it's also protecting your family. So that's really the most important reason to be vaccinated, because you are the host for this virus. And by getting vaccinated, you can not only prevent yourself from getting ill, but you can prevent yourself from infecting others.
And so, Tony, maybe tell us a little bit about how vaccine actually works. You hear some people saying that effectively you're getting COVID when you get vaccinated. And some people even thinking that when you are getting the vaccine, there's a risk that you could potentially get sick or infect other people as a result. Could you just maybe tell us, as someone who develops vaccines, what actually happens when you're being vaccinated and how does that work?
Well, I think the people are probably thinking back to vaccines like measles, mumps, rubella, where we essentially defang the viruses. We make them very mild, and we inject live attenuated viruses, and they don't cause disease. This is not happening with COVID, where there is no current licensed live attenuated vaccines. We're taking little bits of the virus, which is the Novavax vaccine, and it's that spike that everybody is focusing on, and combining it with immunostimulants. With the RNA vaccines, Moderna and Pfizer, we're taking RNA, which codes for that spike, and injecting that into people's muscle. And all of these vaccines flow from the muscle into the lymph node, where they actually induce antibodies and white cells, and both are very important. None of the vaccines are infectious. None of them will get into your DNA. And none of them are likely to produce a COVID-like illness. It just doesn't happen because it's just bits of the virus. It's very much like like the hepatitis B vaccine, which is again just a single protein, or the new shingles vaccine, which is a single protein. We're using RNA to actually code for that, or alternatively, we're putting the gene into another innocuous virus like AstraZeneca, into a common cold virus, and it's not capable of producing a COVID virus or a COVID illness.
Thanks, Tony. Sarah, if we think about then, we've heard lots of things about effectiveness of vaccines. Could you maybe just break down what effectiveness means, in thinking about that, as I said, in the context of death, of illness in terms of hospitalization, but also in terms of rates of infection and infectiousness, which of course are two different things?
Actually, Ivan, I think I'll let Tony answer that.
Okay, wonderful. Tony, right to you.
Yeah.
When there's terminology involved here, and it's sort of vaccine jargon, when we look at the main aim of these vaccines is to prevent disease and death. That is what vaccines do par excellence. They often don't protect completely against infection. So we're all very pleased and delighted that not only does this vaccine prevent against death, that's Pfizer, Moderna, AstraZeneca, the ones that are coming here, Novavax as well, and you're looking at 97 to 100% protection against death, which is spectacular for what we might have expected a year ago. Similarly, against severe disease, well over 95%. Now, prevention against, I often say to people that COVID's two diseases, one in the upper airways in the nose and the other one in the lung. And the one in the lung is the one to fear. So if the vaccine prevents against the disease in the lung, as it does, these three vaccines, you don't get sick, you don't really sick, and you don't die. You may get a mild illness, or you may get asymptomatic infection with the alpha strain, about 10 to 15%, and with the delta strain, about 15 to 40% will get asymptomatic infection. What we mean by effectiveness is that in field studies, we're looking at how good the virus is in preventing disease and infection. And it's a check on what we see in the trials. The trials are only 30 to 40,000 people. It's still a lot of people. But when you start looking at populations, you're looking at millions. So you'll hear people talk about efficacy. That's a term applied to trials, and effectiveness is a term applied to populations. Does that help?
It certainly does, Tony. And when we're thinking about that then, so if I'm vaccinated, what you're saying, I suppose, is vaccination doesn't mean that you are 100% guaranteed that you won't get the virus.
Correct.
It does significantly limit that, and I'd be interested for some of the numbers here, but what it certainly does is limit your ability to be infected. It certainly greatly inhibits your ability to then infect others, even if you were infected. Right. And it's very, very, very effective, much more than many other vaccines that we've seen in our quest of vaccinating populations for other diseases in terms of preventing against serious illness and death. Is that fair?
Absolutely. You've got this gradation, as you very nicely pointed out. And I'll give you some of the figures. People may not remember them, but they should remember your gradation, and that is almost complete protection against severe disease and death, lesser protection against spread, and lesser protection with the Delta strain. So the figures are these, that when we're dealing with the alpha strain, we are looking at both vaccines, AstraZeneca and Pfizer, somewhere in the 85 to 95% protection against spread. Unfortunately, with the Delta strain, it's not quite as good as that. Pfizer is 88% and AstraZeneca is 60%. So, but you don't get severe disease. That's the key issue that we're talking about here. Delta is more spreadable, but you can imagine if you've got 80% of the population immunized, and you reduce the amount of spread even by 60% with AZ, which will be, about a quarter of the vaccines we have, you're going to stop those viruses circulating, and that will enable us to get back to a relatively normal society with businesses opening and without having these surges and lockdowns.
Absolutely, and I would agree with Tony. It is really to reduce the circulation of the virus within the community is why we are being vaccinated, but also is to protect our loved ones and our family.
And I'll just say one thing about families. Spread within families is less protected by the vaccines than in the general community. There's still some protection, it's over 50%, but, and that's with full immunization, but the intimacy of family connection in the same house is substantial. And that's the reason for these discussions about southwestern Sydney limiting big families from mingling with each other, because you'll have as you may have heard, the Delta strain in one family infects everyone in that family, and you only need to get them to mix with another one, and then you've got another family infected. So that's the reason why we've heard the Premier and the Chief Health Officer try to convince people not to mix families.
And one other thing to understand about the Delta variant is that a recent study that came out of Guangzhou, China, showed that this variant has 1,000-fold more particles in your upper respiratory system than the original infecting Wuhan strain. So in other words, even if you are vaccinated and you become infected, you could be carrying a lot more particles in your upper respiratory system than with the Wuhan strain, which makes you more infectious to others.
Sarah, that's wonderful. And coming back to that point, and also Tony's point, so just to be clear, the infection within families is because of the intimacy of contact that you have within that family group in terms of living at very close quarters and the issues of inside and respiration. That's the issue with the spread within families. Is that right?
That's
aerosol spread.
Yeah. The minute you go inside, it's 30% increase in infection. But with your families, it's even greater because you're much more closer to them.
Yeah, right.
So you're okay surfing this morning, Ivan?
That's right. Moving on now to risks, which I think is really, really important that people are aware of these issues around the risks with vaccines, but in a very balanced and even-handed way. Maybe, Sarah, if it's possible to start with you about risks. There's been a huge amount of comment on about what the risks are of vaccination. In some cases, as we've heard, that it changes your DNA, that it gives you bits of the virus, which I think Tony's already dealt with. But maybe just tell us a little bit about how it is people should think about risks and what the risks are that have been associated with the vaccines that we're actually seeing distributed in Australia. Sure.
So the risk with the Pfizer vaccine has been not an immune response. I will say immune response, but a actual. Tony, help me here.
Allergic
response.
Anaphylaxis.
Yeah. So with the Pfizer vaccine, it's been an allergic response, and this typically takes place within 15 to 30 minutes after you're vaccinated. So that's why when you're vaccinated with the Pfizer, you're asked to sit for 15 to 30 minutes. And if you've had any sort of allergic response, say to a bee sting or anything like that, just let the people know there and they'll actually watch you for 30 minutes. Those of us who haven't had an allergic response, they watch us for 15 minutes. When we move on to the AstraZeneca virus, there has been a clotting syndrome associated with this vaccine, but it's very low numbers. So for those people who are 60 and older, this clotting syndrome is really about 2 cases in 100,000 people. If you're less than 60, it's more like 1 case in 100,000 people. And as Tony likes to say, those people who have sadly passed away from AstraZeneca, it's really a case of maybe 3 in a million or 1 in a million. So you'd have more chance of being struck by lightning than dying from this clotting syndrome, which is associated with the AstraZeneca vaccine. And what we know is that if people pay close attention to whether they have a stomach ache or a very serious headache, and they go and talk to their GP right after they have these symptoms, that this can be mitigated very quickly. There is treatment for this clotting syndrome. And so the risk from AstraZeneca is very, very low. And Tony, you may want to add to that as well.
Yeah, if I can, Sarah, I agree with you. I think that one of the things that's really important is that this is a very special type of clotting syndrome. It's not normal clots. I often get asked by people, I had clots. Clots are very common. And in fact, in the trials of AstraZeneca, there were fewer clots in the vaccine group than the placebo group. This is a specific syndrome which is induced very rarely, as Sarah said, in 2 to 4 per 100,000 people, depending on age. And we now, in the first case, everybody was really scared because it had a 25% mortality rate. That's declined in Australia to under virtually, what have we had? We've had about 2 deaths in about 40. So it's very low now, and in fact it amounts to a death rate of 1 in 2 million is the latest figure that I've heard. So you have to really weigh up 1 in 2 million versus if you're over 80, a chance of 15 to 20% of dying of COVID if you're unimmunized. So that's the way that our expert scientists have advised the government, and that is, as you rise above 60, the death rate increases 2 to 3-fold between 60 and 70, 5-fold over 70, and then 20-fold over the age of 80. And if you have transplants, it's 4-fold. So obviously, if we've got AstraZeneca around, then it's critical that we immunize people. And as you've heard, we've got 40 people in hospital and 7 in ICU, and that could be prevented with AstraZeneca. And as the Minister for Health pointed out, in the West Hoxton party, there were 20 people, 6 did not get infected and 14 did and got disease, and the 6 people without infection or disease had been immunized. And that's a local example of some of the things that we've been talking about.
And one of the things we should bring up, Ivan, is that with the Delta variant, the incidence of severe disease and death increases.
Yeah.
So even the numbers that Tony gave were for the original Wuhan strain. And with this Delta variant, it's much more severe. And the rate of death, the death rate from this variant is much higher.
Seems to be in younger people too, doesn't it, Sarah?
Exactly. Yeah, it seems to be affecting younger people severely.
And just one thing I think that is important here. So Tony, looking at those numbers that you gave us earlier, the risk of clotting from AstraZeneca being very, very, very low is actually even lower in younger people. The reason why the health advice has been given is not because the risk of clotting is higher, but because the risk of issues with COVID is higher in older people. That's fair.
No, well, that's not quite true. The risk of getting the immune clots, and I say these are the antibody-induced clots, is lower in older people, but it's only marginal. But you have to match that up against the risk of death from COVID, and so you're weighing them up, one against the other. And that was the reason for the over 60 age group, both 2 reasons. One is there's a marginal increase in